medications. And now we're going to talk about regeneration, because that is the future of aesthetics. We are seeing more and more treatments come out that are regenerative. And if you were with us recently when we launched Exosomes, you'll remember that we love Exosomes. As I mentioned earlier, Exosomes has replaced a lot of the PRP in our practice. We still do PRP, and we still do, if that's what you prefer, we still do PRP. We have Exosomes, which is donor tissue from 18 to 25-year-old females, and stem cells from Wharton's jelly, which is the insulator in the umbilical cord. This is all tested, no DNA transfer. It's from Antiage, who is a company who is big in the United States. And we buy our exosomes from them. If you prefer something that is not human derived, we have biosomes, which are synthetically engineered exosomes. So we have something for everybody in that arena. Exosomes don't replace treatment, they amplify treatment. So we've been using exosomes after we do cool peel, after we do microneedling. We use it in our little hydra needles. If you've ever come in and have the hydra needle, which is like the microneedling, and we also use Botox and a little bit of Juvederm with that, just to give you the pore tightening, the hydration, and that good exosome collagen stimulation. We find that those clients heal up much more quickly than they did with PRP, with much less inflammation. And we get a much better result with collagen stimulation. We love our exosomes. Exosomes play a role in cellular communication. So if you remember, exosomes are the little, think of it like little text messages that go from one cell to the other. This cell is telling this cell, hey, you need to act younger. You need to act right and do your job. And that is the part that we lose as we get older. And so using these exosomes on impaired tissue will make that skin act like it used to. It gets the message to act younger. We see faster healing, improved texture, tone, and density, and the hair restoration. You guys, I have never seen hair restoration like I'm seeing right now. I am so on fire about this hair restoration. So this is a young man who had actually been in a car accident and had rubbed the hair off of the head in hospital. He was in the hospital and in rehab for a period of time and had lost a little bit of hair. And we use the exosomes, and this is 1 month later, less than 1 month later. You could not find where those spots were, and those spots looked like they were struggling to grow hair. So this was an amazing transformation for this person. Very excited about that. This is another person. This is a couple of days less than 1 month apart, and you can see that fine hair growth growing in right in the center of that spot there. And you can also see that the overall hair is looking thicker and healthier. It's funny how fast this happens. I would say doing an exosome treatment on the hair is much like doing 4 PRP treatments. That's the kind of results that I'm seeing. And a lot of the photographs I'm showing you are people that have done PRP, and they were just kind of holding their own, maybe seeing a little bit of growth, but we weren't getting anywhere. And it makes sense because say I am working on a 50-year-old person, they have 50-year-old PRP. That PRP may have some vitamin deficiencies, some hormonal deficiencies. We may not be operating with prime liquid. And if you've gone out with your girlfriends the night before and you've tied on a big one, you really might not have beneficial PRP that day. And we just have no true way of knowing. With the exosomes, it's a constant product. We're getting the same product all the time. It is developed from these young paid donors and these donated C-section tissues. So it is consistent quality product, and we're seeing amazing transformations. Here's another. So this is another gentleman that we have been doing PRP for about a year, maybe 2 years. And you can see on the left there, he had a significant clear patch there, but it was, had a little fill in, and we were happy with the results with PRP. But you can see in 1 month, he really started filling in. And by this third photograph, which was after 2 months, so we're not even seeing his final treatment in here. So this is between November 13th and January 14th. He was seeing significant coverage in the area. And you can see his overall hair just looks healthier and shinier. There's a lot of hyaluronic acid in this product, which helps the scalp and the hair to have a lot more moisture. And this is another young man that we have been really trying and really hoping to see some progress with PRP. Saw a little bit, but it just wasn't enough to be that impressive. And this is after 2 treatments, and we're seeing that kind of hair growth. So excited about this. If you know anybody with thinning hair, I have a lot of females too. I just don't have the consents just yet. So we'll be posting those on social media, and we'll try to get some of those out to you to see as well. I have a female who is 76, and it is amazing to see the growth that she's had. So I'll try to get that one and share it with you as well. But we love the exosome therapies. They are amazing. There's so much going on in the medical world with exosomes, and we're excited to be able to bring just a little side portion of that to you here in the cosmetic world.